And then presumably it's, yeah, that sounds like it's...
Okay, so we've just been to this. This is Manish Juneja and
Dr. Keith Grimes.
we're here in London. We've just been to this world's first virtual reality theatre performance called Control. And now we're just going to drive around in central London. What we thought is we would. We're in this. I've got this Toyota Prius, and it's got a whole bunch of safety features designed to protect you and brake for you if you get too close to the car in front, and you know, the stepping stone towards autonomous driving, if you will. And then whilst I had Dr. Grimes with me, I thought I would just have a conversation here on this 360 video about what does this mean in terms of, as these sensors are here at the moment, in terms of are we going to have sensors in the car at one point which monitor our health? What do you think, Dr. Grimes?
I think when you think about the difference of having sensors in the car makes to healthcare, there's a number of different ways you can slice it. The first of which is you can just say, well, a car that has sensors in it that helps you drive in a safer way is going to have an immediate, very straightforward effect on health. It's going to mean you're less likely to crash and injure yourself, and I suppose crash and injure other people. But then there's also the ability for it to monitor how you're driving and whether that's a proxy for any other aspect of a person's health. So simply put, if a person's tired, the classic one that you might think of is obstructive sleep apnea. And one of the questions you ask in the Epworth sleepiness scale is how likely a person might be to fall asleep if they were just sitting quietly in traffic.
But what about getting, I mean, there's people who are saying, well, you know, why not install sensors in the car that can collect biosensors that can monitor your health as you drive, and can possibly, you know, as cars come with 4G connections or 5G, your car will automatically stream data to your doctor, to your electronic medical record, you know, your blood pressure's rising during your morning commute, and that whole real-time feedback that your car would say, hey, you know, this commute is stressing you, I'm going to reroute you through to an alternative route. I mean, is that science fiction, or do you think that that's going to become a reality in our lifetime?
Is it science fiction? No, because I think you could probably put that together with the technology that's around right now. I think that the car should be responsible for the car's own sensors. I think that the car, if you relied on the car to be measuring a person's blood pressure or pulse, then you're going to have a disconnect between that recording when the person steps out of the car. I think we're going to move towards a point where a person's blood pressure and personal metrics will be streamed from them wherever they are, and then the car will measure the metrics from wherever it is about the car. The interesting thing, of course, will be when those two sources of data are brought together. So the car then becomes aware from the data that you're streaming from yourself that your blood pressure is elevated, but it's also picking up that you're driving in a way that is slightly more aggressive. You're closer to the car in front, you're braking later, you're swearing more, you're sweating more, those sorts of things. And at that point, it can then help make decisions about your driving, but also actually look at how changes in the driving environment physically affect you.
So I'm just trying to think also of the role of what's in it for, say, insurance companies. Are they interested in health data that's collected whilst we drive because they want to know, well, you know, were we stressed out and we were at a higher risk because we made a flawed decision because our heart rate was elevated beyond a certain level, and even linking to information that you didn't sleep that much last night, and then using that to not pay your insurance claim because you made the wrong choice when you drove the car this morning, that you didn't have enough sleep, and all that data linking together.
I think we're entering into a period where there's all of those things that you've raised, all those questions you asked are going to start to be answered. I think one of the first things that might happen is as you collect the data from the vehicle and you collect the data from the people after an accident or incident or a near miss, they'll be able to look back and say, well, was there anything about that person's blood pressure or their concentration level or their respiratory rate that might have given some indication that they were just about to crash?
I mean, for example, with your patients, would you ever be interested in having access to a stream of data, about their health from their daily commute, from their would you be interested in, say, your patient may not, who's got some chronic disease, may not visit you for 6 or 7 months. Would you be interested in sensor data from their home, from their car, about their health? I mean, how do you see that from a doctor's perspective?
Yeah, I wouldn't be interested in the stream of data, I'll tell you that much, but I'd like that data to be converted into something that informs knowledge. So I think all that information being in some way compiled and passed on to me, either through passage through cognitive computing or an analytical algorithm that turns what was obviously going to be a huge amount of data into something meaningful, that would be useful. The other thing is, of course, the emerging role of the digitalist, the idea that you have clinicians that are specifically trained in understanding and making sense of this data. I think for most modern clinicians or current clinicians, they get quite scared at the idea of all this data, and of course there'll be a lot of data coming from the car, but I think I would certainly be interested in summary data from the car if it was a repository of information that impacted on there.
And I'm trying to think as well in terms of, you've got aging populations around the world. What if the car could actually tell you, as the primary care physician, whether me as a 80-year-old driver, my cognitive function is declining because the car is sensing that I'm taking longer to press the brake when a car stops suddenly in front of me.
Well, do you know what I think's really interesting?
And then that feeding back to you as an alert to say, hey, look, Mr. Junaja, this is what's happening to his driving reactions, and actually the car scheduling an appointment with you, or a geriatrician to say, I think he should come in for a checkup before his annual physical.
I think that might be part of it, and obviously you've got the management of patients with diabetes and monitoring for hypoglycemia as well. That might be another thing, but I like to think of it flipped around slightly. I get excited about the idea of smarter cars being able to take on the duties of driving for those patients that maybe have healthcare issues that stop them. And so one of the hardest points for any of my patients who have their independence curtailed because their health stops them driving, if we could safely allow them to drive and maintain their independence for longer, that would be an amazing thing.
Very good.